My name's Lauren and I'm here to talk to you today about the Derbyshire Home from Hospital Support Service. After you've listened to me today, you'll become a Home from Hospital champion and we'll learn about how to refer into our service, who our service is for, and the types of support that we provide. The Home from Hospital service is funded by Derbyshire County Council and supports people living in Derbyshire, excluding Derby City. The aim of the Home from Hospital service is to provide support to people who are leaving hospital. They may have just been discharged home, or perhaps they're already at home and at risk of being admitted. We can provide simple, practical support for people for up to 6 weeks. The types of support that we can provide includes things like shopping and collecting prescriptions, fitting key safes in line with discharge. We can arrange for false alarms and telecare systems to be fitted where there's a need. We can help people to get out and pay bills for them and make appointments. And we can also signpost people to other services available county-wide or in their area. So who exactly is the service for? Well, the service is primarily for people with very limited or little family or community support. So this might mean that they don't have any family who live locally, no friends who can support or neighbours, or perhaps they just don't have any family left and they don't have anyone to rely on for the basics anymore. So that's where we can come in and provide that practical support to help them get back up on their feet after a hospital admission. So once we get a referral from the hospital, our hospital coordinators go and visit the patients and complete an assessment. This is where we speak to the patient and find out their worries about returning home and see what we can do to support with that. Whether it be that they need a bit of shopping just while they get their confidence back after a fall, or perhaps they'd like a falls alarm put in because they're scared of falling again and having no one around to find them. Or maybe they need a key safe fitting before discharge to facilitate a care package. All of that we can discuss and put in place. So once that is done, we pass the referral over to our district coordinators. So in all 8 districts of Derbyshire, we have coordinators who cover and support in the community. So we pass the information over to them and then they will make contact with the patient, and then post-discharge they'll put the support in place and make sure everything runs smoothly for them. The support is for up to 6 weeks and is free of charge, and if there is more support needs following the 6 weeks, then we will always help that person to plan for future support that is needed. Anyone can refer into our service, whether that be self-referrals, family members, and of course professionals on the ward. So anyone can refer into us. So I'm going to talk to you now about a case study of a lady who we supported on hospital discharge. For the sake of her privacy, we're going to call her Maureen. So Maureen was admitted to hospital following a fall in her kitchen. Maureen lives alone and she'd fallen and broken 2 bones in her pelvis and was in a lot of pain. Maureen was medically fit for discharge and didn't need a package of care to go home with, but was worried how she'd manage the little things, and that's where she got referred to Home from Hospital for support with shopping. So I met with Maureen on the ward and we discussed her worries about returning home and what we could do to help. So I discussed the shopping support with her and she was relieved that there was something that we could do for her that would give her the time to recover that she needed. So shopping support was ticked off, and the more I spoke to Maureen, she told me more of her worries. Now Maureen told me she was really worried about falling again. So this was her first ever fall, but it was quite severe and Maureen lived alone. So we talked about a care line or a falls alarm, and Maureen thought this would be a really good idea as it would give her that peace of mind that if something did happen, she'd be able to call for help. And we also discussed a key safe, and Maureen thought this would also be a good plan, as if she had a key safe fitted and there was an emergency, then entry wouldn't need to be forced into her home. So that was another thing ticked off the list. So Maureen was discharged home. Her family all lived at least a 3 hours drive away, and some lived abroad, but one of her sons came to visit her for a couple of days once she was home, and following that our district coordinator got in touch with Maureen and arranged the shopping support. So they would call up once a week to get a shopping list from Maureen, and then a volunteer would collect the shopping and deliver it to Maureen and help her put it away if needed. So the referral for care line and a key safe was completed, and these were both installed within the same week. So Maureen felt much safer now being at home with some support. But she was a little bit frustrated because she'd always been so independent and used to get out and about. So she felt quite lonely being cooped up at home. So this is when the district coordinator decided to suggest to Maureen perhaps she'd like a befriending service to be referred to so that she could have some company. And Maureen thought about this and decided she would. So she was referred into a befriending service locally, where she was matched with a befriender who could then come and visit her at home while she recovered, so she had some company. She was also signposted for assisted bin collection, as Maureen couldn't manage to take her bins out and none of her neighbours really knew her or were able to help. They were older themselves. So we signposted her for that so that the council could fetch her bins out for her so she didn't have to struggle herself. And the other thing that Maureen was signposted for was a falls prevention group, which is available county-wide in Derbyshire. And because she was so worried about falling again, then she thought this would be a good preventative measure for her to go and attend these falls prevention groups so that she could build upon her strength and catch herself in the event of another possible fall and just keep herself a little bit safer. So as you can see from that case study, we were able to support with a number of concerns for this patient, including the shopping, fitting a care line and a key safe, and signposting to groups and befriending services and the assisted bin collection. It's all things that a lot of us take for granted being able to do, like taking the bins out, or the neighbour will do it if you can't. But when you've not really got anybody, these are the sorts of things that we can support with. So there are a number of other services available county-wide and in the individual districts of Derbyshire. So if ever you're unsure if we can support with something, please always ask us, whether that be getting a hospital bed moved to facilitate a discharge, or key safes, or certain types of groups. It's always worth an ask. So you are able to refer into our hospital-based team by calling this number 07305 099 207, or by emailing home@dhfh.org.uk. I hope this has been helpful to you and you are officially a Home from Hospital champion. Thank you very much.